My name is Jalen Proctor, and today I am going to be doing my speech on labeling psychopathic tendencies with the Robert Hare test. The term psychopath evokes horrible thoughts in our minds, or for at least me, it does. When I was a child, I used to think they were depicted out as a bug-eyed lunatic tied to a chair in a restraint jacket locked up in an insane asylum. It is with no doubt that we live in a world of judgment. Labeling someone or stereotyping someone is just our natural human instinct to do so. Although it is more difficult to depict out on who is classified as being a psychopath and who is not because we see and label things as black and white without seeing the gray hue. With not understanding psychopathy, we tend to wrongfully accuse those and label those who may contain psychopathic tendencies according to a checklist that was used 50 plus years ago. The label of a psychopath is used and applied way too freely without an understanding as to who or what characterizes that conventional image. Before the 1980s, methods for assessing psychopathy had no validity. With the use of their own clinical judgment, doctors and any medical personnel would self-diagnose their patient. This soon had a dramatic change with the use of Robert Hare, a Canadian psychologist, psychopathy checklist diagnostic tool used to rate a person's psychopathic or antisocial tendencies. Kent A. Keel is a professor of psychology and neuroscience at the University of New Mexico. He believes that the checklist has played an essential role in the assessment of psychopathy during the last 20 years, allowing psychologists to have somewhat of a grasp on who or may be a psychopath. While we think we are helping those who may not contain psychopathic tendencies, Kent Keel and many others who study psychopathy completely disregard the fact that it's morally wrong to base someone's mental illness off of a checklist. It has no true validity to diagnose someone's mental health. Researchers and practitioners have used the PCLR to enhance all research and clinical work. In John Ronson's book, The Psychopath Test, Ronson provides the characteristics of his now famous 20-point Hare PCLR checklist, which was this: superficial charm, grandiose self-worth, need for stimulation, pathological lying, cunning and manipulativeness, lack of remorse and guilt, shallow affect, callousness and lack of empathy, parasitic lifestyle, poor behavioral controls, impulsivity, early behavior problem, lack of realistic long-term goals, irresponsibility, failure to accept responsibility, and many short-term marital relationships, juvenile delinquency, revocation of conditional release, and criminal versatility. While it is true that most psychopaths contain those characteristics, it does not follow the spectrum of everyone's tendencies. People can be ranked high on the checklist of the PCLR, but still not fit the clinical definition of someone who contains some type of antisocial personality disorder. Susan Krauss Whitborn is a professor emerita of psychological and brain sciences at the University of Massachusetts. She states that just receiving the training, even if it goes on for 2 or 3 days, isn't enough to produce a qualified psychopathy rater. At moderate to low levels of characteristics of psychopathy from the PCLR, it can be difficult to provide an accurate assessment and clinical diagnosis as to who fits psychopathic tendencies. Psychiatric diagnosis of people who are seen to have psychopathic personalities are strongly implied by Robert Hare's PCLR with the usage of stereotypes. Throughout psychiatric practices, Gale and Context, Science New Findings from University of Toronto in the area of ethics state that psychopaths have been predominantly seen as immune to psychiatric intervention and treatment, making the diagnosis a potentially strong discriminator for treatment amenability. Robert Hare's idea of the PCLR seems as if he was doing the right thing, but it demonstrates unscientific conclusions. Gale and Context also stated that instead of researchers and practitioners should be more optimistic about the ability of treating and rehabilitating diagnosed psychopaths, instead of basing someone's mental illness from a checklist. Diagnosing someone's mental illness, even when having the training to do so, is still unethical, basing the diagnosis off of a checklist. Having the label of a psychopath that society gives you isn't something you can easily get rid of. Once labeled schizophrenic or of any other mental illness, the patient is stuck with the label. There's no for sure cure to psychopathy. No pill can make you have empathy, no vaccine can prevent someone to go on a murder spree, and no amount of therapy can change the uncaring, ruthless mind. For all intents and purposes, psychopaths are lost to the normal world. Dr. Kent Keel, a psychiatrist at the University of Mexico, discovered that psychopaths have reduced gray matter in their Paralympic system of the brain. Those who have stunned Paralympic systems have it from the start of birth. But staff at the juvenile detention center, treatment center, created the decompression model, which gets rid of the vicious cycle of different discipline and defiance that people with psychopathic tendencies had. And the decompression model is positive reinforcement to show the wrong by training the brain to go away from psychopathic tendencies that has developed. When good behavior is spotted, it is reinforced with some type of reward. By doing so, those with psychopathic tendencies are introduced to simple benefits as to what is normal to society. Studies have shown that over 300 subjects who were treated with the decompression model were compared with similar subjects as to those who weren't treated with it. Mental health is something we tend to use for a cover-up with situations such as school shootings. We always see the school shooter labeled as someone who is a psychopath, even though with the spectrums of psychopathy, they don't apply to everyone. Psychiatrists are stuck in the old ways of using methods such as Robert Hare's psychopath test to attempt to cure those with psychopathic tendencies, and by labeling everything as a mental illness, from the littlest things as nose picking to a truism, lottery, and playing with action dolls. Moreover, the study of psychopathy has been challenging for many years and continues to be challenging. Although there is no clinical definition of who fits the title of being a psychopath, it is still morally wrong to identify somebody's mental illness based off of a checklist. Thank you for listening to my speech.